Diabetes is an epidemic in the United States. 25.8 million people have the disease, but it is estimated that another 7 million people have diabetes and have not yet been diagnosed. African Americans and Hispanics are nearly twice as likely to have diabetes than whites. Death rates among African Americans and Hispanics are higher than whites.
Well, I was feeling a little ill, and I thought I'd go to the clinic and get myself checked out. One of the nurses wanted to take my sugar. She pricked my finger, and she just looked at me. Went and got the doctor. He came in, he said, "You need to go to the hospital right now. Do not go home, do not go anywhere else, go straight to the hospital. It's a wonder you're walking. Your sugar level couldn't even be read." So I went to the hospital, and once I got there, they immediately took me in the back room and started hooking me to the heart monitor, and then they instantly poked me in my stomach. I guess that was the insulin.
Type 2 diabetes is a condition in which your blood sugar level is too high. After you eat carbohydrates, chemicals in your small intestine break them down into single sugar molecules called glucose. The glucose enters the bloodstream. When the blood reaches the pancreas, it detects the rising sugar levels and releases insulin. Insulin allows your body to use the glucose as energy. If you have type 2 diabetes, either your pancreas does not produce enough insulin, or your body's cells resist its effects, or both.
Diabetes is a chronic condition. It can affect the eyes, and it also can affect limbs. By not being treated, it can cause premature death.
I noticed that my eyes started to get blurry, to the point that I could not see. That scared me. I'm like, I cannot go blind.
Almost 50% of those with diabetes don't recognize it. And by not recognizing it, the first time they may see a complication, a seizure, problem with vision, and by that point, it's very late in the progress. There's a disproportionate number of folks that are disadvantaged. So the thought of getting tested is something that people don't often consider. What happens is these individuals are afraid. They're afraid of their doctors, they're afraid of the health system, and they feel like if they don't have any side effects, they just wait, maybe it'll go away.
I was about 368 pounds. It was real bad. I didn't want to admit it. Exercise, I don't even know what that was. I thought I was perfectly okay. You know, as long as I'm still getting out the bed, I can still move, I should be okay.
Being overweight or obese increases your risk of complications, but losing weight can help you get your diabetes under control.
First challenge is to make sure individuals know they have diabetes. The second challenge comes in once a patient knows they have diabetes.
One of the issues doctors face with diabetes patients is getting them to realize their lifestyle must radically change in order to be healthy.
What Chartered Health Plan has done is try to handle those that know they have diabetes. We've started a pilot. It's not a very large one, but it's a beginning. We've enrolled about 50 individuals. We've given them phones to get text messages. We can give the individual a text message, and it can enhance the relationship with Chartered and with the patient and with the physician.
Sam called me and said they had a new program with a cell phone. He's gonna monitor my diabetes. And I'm like, how are you gonna do that with a cell phone?
These text message reminders will help encourage the member to do the activity that's helpful for them.
Little tips on how to manage your eating habits, exercise, and different things like that. And he said, we're going to send you texts, and you got to text us back. And I'm like, okay, why?
When you're involved in your care, you are more likely to follow through and get a better end result. This is not to replace the relationship the patient will have with the doctor, but it's to enhance that visit.
Now, I got somebody else other than my daughter checking up for me, making sure that I'm doing what I'm supposed to do. Thank you.
You're welcome.
At first it was like, okay, why do I have to do this? But it's a great thing to do because it's good to have someone else who can, you know, keep you encouraged and keep you going on with it, because sometimes it gets a little hard, especially if you already been eating terribly. You want certain things, you can't have it.
Thanks to her text message reminders, Harriet monitors her blood sugar regularly.
At first it stayed in the 300s. It's still high, but it wasn't high as before. And then When I saw when it started going down to 200 and I saw my weight start going down with it, I was like, okay, this might be a good thing right here. And now I always try not to go over 120.
In just 6 months, with these reminders, we found a 10-fold increase in those that were getting the blood test done appropriately. We found also about a 10-fold increase in other processes they were supposed to do, checking their kidney function and also checking for their eye exam. This was just remarkable.
Bon appetit! I feel much, much better. I feel lighter.
Not bad.
Even feel sexier, if I could say that. It just made me more confident to do more. I feel so great about that. And for your ladies out there, I was a size 30 and now I'm a 20. And they'll know what I'm talking about.